Call it a nation in crisis, a different kind of pandemic. And no, I'm not talking about COVID-19. It's where we start tonight on News West 9 at 10. Thanks for joining us. I'm Tatum Gwen. Now, this is a conversation that police are pleading for parents to have with their kids. Stay away from opioids, especially ones that are not prescribed to you by a doctor. Now, we told you last night about a young 15-year-old in Odessa who overdosed on fake oxycodone over the weekend. A lot of you talking about the dangerous drugs and overdosing online. A new and quite frankly scary trend happening more and more often. Here's the question, Jonathan. Why is it popping up more and more, and what can we do about it?
Well, Tatum, this is definitely a problem that's going on, and it's all across the country, not just here. And you know, it's specifically with the opioid drugs, including oxycodone, like you said, which was a drug that one teen overdosed on here in the Permian Basin. Now, these are those pills that were found on that teen. Now, I got the opportunity to speak with one local healthcare official about how we can prevent something like this from happening again. It's becoming much easier to get your hands on opioids, something that's created a big problem.
In so many different places in Texas, right? You can buy that off the internet and you don't need a prescription for it, and you're able to get something like that. So that means there's no regulator that's looking at those to make sure what you're getting is actually what it says it is.
In fact, according to the CDC, there were about 93,000 drug overdose deaths, and it can be difficult to know whether a drug, such as a non-prescription oxycodone, might be laced with something else, which would cause more issues.
We don't know what it is laced with until it goes to a lab and you can analyze what's in that pill. So we don't know what to give to treat a person that has taken a opioid that is not from a pharmacy.
And what makes things even more difficult is that pain itself is subjective, which has the potential to lead to an overdose.
Pain is subjective. So people say, well, he gave me this much for the pain I'm having. Now I'm having more pain, so should I take some more? And they make that adjustment themselves. And that's when it starts to get dangerous, is at that point, they don't know how this medication is building up in their system.
So how can we prevent this? Well, it's twofold.
You need to recognize that this is happening to you or to a loved one. You want to try to prevent it as much as possible by knowing not to get into that. But if it does happen, then you need to know how to respond to it.
Now, there are ways that you can educate yourself on this type of problem, which include looking up resources to counter potential abuse or dependency. Now, there are centers here in our area that can help, including the Permian Basin Regional Council on Alcohol and Drug Abuse, just to name one.